So today we are doing instrument class. This is first of the series because in one session we cannot finish. So I have started with ERCP instruments because these are the instruments which are most commonly will be kept in your DMV exam. And we will start with the guide wire. So normally what happens in the lectures are mostly taken as one-way learning method. So we may not keep it completely one way. So if somebody wants to ask in between, he is free to ask. We will stop or pause and then we will try to answer. Because if we don't do in continuous manner, so lots of questions get lost ultimately. So that doesn't serve to the learning and teaching cycle. So Dr. Amit, you can, okay. So we are starting with ERCP guide wires. So every ERCP procedure virtually will require guide wire. It is not possible to do ERCP without the guide wires. So when we talk of the guide wire, there are two components of the guide wire. One is called coating of the wire, which is basically most of the time there will be surface coating, and most of the current generation guide wire, it will be polymer coating, so making it insulated. So that is, and the other is core. So core is almost always metallic, and as I'm going to show you subsequently, that most of the current generation guide wire will have a metal core which is made of nitinol. As you know that nitinol is a alloy of nickel and titanium, and this is very widely used in medical field just because of its thermal memory. So this wire has very strong. This metal has alloy has very strong thermal memory. So if you give a memory at 50 degree, the moment the 50-degree temperature is achieved, that particular save will be taken, and the save can be completely different, say for at 20-degree temperature. So you can see YouTube video for this. There are very nice YouTube videos available on the thermal memory of nitinol. Next, we have some terms which are used to describe the wire. One term is protected wire. What is meant by protected wire? So protected wire means that guide wire is basically insulated. So you can keep the protected wire in place, and one can go with the use of electrosurgical equipment or cautery, which you say. And so basically you can do a sphincterotomy, needle knife, and all those things. So there is no risk of leakage of current. So most of the current generation wires are protected wire, but there are certain wire which are still in use and non-protected. And as we go, we will I will keep mentioning. But most commonly, like thermo wire is not a protected wire. Roadrunner and Pathfinder, which are very thin wire, very specialized wire, they are not protected wire. But the other common wires like Jag wire, Hydra Jag, Visiglide, Optimus. So these are the protected wires, so one can keep. What happens that if you use unprotected wire and do a sphincterotomy, there can be current leakage. And what happens that current density is maximum where the wire diameter is least. So wire diameter is at the tip, and because there is also tapering of the wire towards the end, so their current density will be maximum. As you understand that the tip will be inside the bile duct or pancreatic duct, so their injury will happen, perforation will happen, and interestingly, operator will not be aware of it because that is not into vision. So one should do a sphincterotomy or use electrosurgical equipment only over the protected wire. One should not use over unprotected with the wire which is not protected, like thermo wire or Pathfinder or Roadrunner wire. Hydrophilic wire. So this is because core is not into contact with the surrounding. It is the coat which is in contact with the surrounding. So the more hydrophilic wire, the more slippery it will be, and it will have tendency to slip through the stricture, narrowing, or any of the difficult area. So this is a desirable characteristic for negotiating the stricture. But when you are handling, if in the shaft is very slippery, then it becomes very, very difficult to handle. The most hydrophilic wire uh, created so far, which is into use, is thermo wire. So the thermo wire is a very, very hydrophilic wire, but now we have hybrid wires. So tip will be thermo and the shaft will be something different and coated with a polymer coating. So hydrophilic is the material is called M coat, yeah, or aqua coat material. So that material is blackish looking. You must have seen the thermo wire. So that is important. But hydrophilic property is active till the time wire is wet. So when if you are using very, very hydrophilic wire, you have to keep it wet. So most of the time on the biopsy valve or the working channel, we keep little bit gauze there and keep passing the wire through that so that it remains wet. Then there is another term which is called floppy tip. So what is meant by floppy tip? So whenever you use the wire, you can touch the two end of the wire and you will feel one end is hurts on your palm if you pass like this. So then one will hurt and other will not. So the end which hurts is the reverse end, and the one which doesn't hurt you is the floppy tip. So floppy tip is to reduce the risk of perforation by during guidewire manipulation, and this happens because the core and coat both taper towards the tip. So you like most commonly you use 0.035 inch guide wire. So that will taper to something like 0.027, and that's why it is very soft or atraumatic. So that reduces guide wire related perforation risk. Torqueable wire. So what happens that in some of the situations, like imagine the situation that you have gone through the selective cannulation, you are into CBT and want to go to right hepatic duct or left hepatic duct. So what will happen that guide wire will keep going into one direction and you want to change the direction. So in that situation, we use angle tip guide wire. So guide wire tip can be straight or it can be angled. And in the angle tip, if you obviously rotate the direction of angle from the right to left or left to right, so vice versa. So that when you rotate and guide wire rotates inside the wire duct, if that property is there in the guide wire, so that is called torqueable wire. So not all wires will be torqueable, and this is done with the help of a device which is called torquewise. So this is available whenever you purchase Jag wire or say for even VG-Glide. So then you get a small device, plastic device, through which the guide wire will pass and it can be locked. And after that, you rotate like this, then the guide wire will rotate inside the bile duct or pancreatic duct. So that is called torqueable wire. So it can be rotated to change the direction of cannulation. Then exchange guide wire. So guide wires are available in different length as we go. We'll be seeing. So the basically to act as exchange guide wire, you require twice the length of your cannula or your scope. So basically, most of the cannulas will have the length of something around 200 centimeters. So all exchange guide wire will have 400 plus centimeter. So actually, what previously all the Wilson hook wire used to be available 480, and all the Boston Scientific guide wires used to be 450 centimeter. But now the Wilson Cook also has modified, and the newer wires from Wilson Cook is also 450 centimeter, and from Boston Scientific is already 450 centimeter. So that will be the length. So that is one characteristic which makes it exchange. The second, that it should not be very, very slippery wire, because completely hydraulic. So you can imagine that thermo wire is generally not considered suitable for as exchange wire, because that becomes very slippery, very difficult to handle. And if you don't keep it wet, then it tends to get stuck in the channel. So that is the problem. So thermo is most hydrophilic. So this is how nitinol will form the core of the wire, and then the surface will be a polymer which will be different on the different part of the wire. Like thermo wire, all throughout will be M coat or aqua coat, And for Jaguar or Hydra Jag, it will be different, which I'm going to show you. So this is the hydromer coating or aqua coat, hydrophilic polymer coating, which is called M coat. Different companies will give it different name, slight modification, but this is our aqua coat. Some of the company call it. So basically, this is hydrophilic coating, which is there. But in thermowire, this will not be good enough to give you electrical protection. So thermowire is not a protected wire. So that you should understand. So then this is M code which I have given you. So this is very, very slippery. So this is available in three variants actually: a standard shaft, half stiff, and stiff shaft. So what happens that the stiffness of the wire changes, and it changes because of what? So basically coating, thickness of the coating decreases. Thermowire is available as a standard shaft, half stiff, and stiff shaft. So there are different, outer diameter remains same, but the stiffness of the wire changes. So that is because of the change in the ratio of the coat and core, which is taking a space. But the inner core will remain retinol, and the coat will remain M coat, ya hydromer, ya aquamer coating, which I explained you. And this is not a protected wire, which I explained you earlier. So then we have another wire, which is called Jag wire, which Jag wire, which is most commonly used. So in the Jag wire, what we have a terminal 5 centimeter, which is aqua coat or M coat. So which is very, very similar to actually the thermo wire. And then the rest of the shaft is this is polymer coated. So polymer coated. So basically this is insulated wire. So this is called on the top of that polymer, we have a special coating which is called endoglide coating. So that is facilitates passage of the wire. So it becomes not very difficult to push. So that is, so basically, if you talk that it combines the two different wires properties. So basically, this tip is like thermo wire, and this shaft is like previously available, which was called zebra wire. So zebra used to have blue and white marking, and this has yellow and black, yellow brown marking available. So you are able to identify because of that. So this 5 centimeter thermo type of coating, aqua coat, so that facilitates through the stricture. And this is again tapering and atraumatic tip. So that is what we described initially, that this is floppy tip. So this will have the floppy tip, and then very stiff shaft, and this is available in different variant. So there are other good properties. So this is called kink resistant. So these are monofilament wire. So earlier what we used to we used to have one wire which is not in fashion, not available now. But some of you who use like putting the central line, then you must have used one wire there, which is like called a spring appearance. So that type of wire used to call a standard ERCP wire. So when we used to try to push, then it against resistance, it used to get kinked. But these are monofilament wires. So the core is completely monofilament, so it doesn't kink at all. And black yellow pattern is there to reduce the fluoro time. So against a pink red mucosa, you are able to see clearly. To see the wire movement, you don't need to do fluoro. So that is the aim of this type of appearance. And the shaft of the wire is not very slippery. So only coat is very slippery. So handling becomes easy. So this wire is available in different variants. Like one is 260 centimeter, another is 450 centimeter. So 450 centimeter is exchange wire, and 260 centimeter is for a use with new system of accessories, which is called short exchange system. A short exchange system. So there, what happens that here we change the guide wire goes completely through the accessories, like through a sphincterotome. whereas the short exchange system, it gets exchanged only through the terminal 5 or 10 centimeter, because there is a port 10 centimeter proximal to tip, through which the stiff end of the wire comes out, and in rest of the channel it remains separate. So it can be a straight tip or angle tip, depending on, you can order, and it is available in 3 diameter, 0.25, 0.025 inch. This is unit is inch, and 0.035 and 0.08. So 0.038 is not an ERCP wire. I have listed here, but it is not an ERCP wire, because practically no ERCP accessory will accept 038 guide wire. So this is basically used for dilatation purposes in esophagus and other things. So like if you see eclesia dilatation balloon, Rigiflex balloon, if you see the catalog, they will ask you to use 0.038 wire, although most commonly we use their Sevre-Gilead steel guide. The shaft can be like 2 types. So that you should be aware that one is a standard shaft and the second is super stiff shaft, yeah, stiff shaft. And I have already explained you how the stiff shaft is made. So there the coat thickness is reduced and the core thickness is increased. So metal part is more and the plastic part is less. So where do you require stiff shaft? So if you are doing, as you start learning ERCP, doing it, so you will learn it. So where you require, when you are doing a stricture dilatation and a stricture is difficult to negotiate, tight stricture, so there you require a stiff extra support, and for extra support you will always stiff wire. The second is like when you are doing multiple stenting, 2, 3, 4 stents, sometimes we put like benign biliary stricture. So the higher the number of stents, like you are pushing third stent or fourth stent, you require extra support because it requires lots of pressure to push the stent. So in that situation, you will require extra support, and then you will use super stiff guide wire in that situation. So this is basically showing that 260 centimeter and then 450 centimeter wires. So I have already explained you, and here you see a stiff shaft and a standard shaft that you can see, and then you have angled and straight tip. So every variant will be available at angled and straight tip. So angle tip is basically used for selective right and left hip right duct cannulation or difficult stricture negotiation. So the dream wire is exactly configuration wise, it is exactly like Jaguar, but Jaguar has only 5 centimeter hydrophilic tip, like thermo tip which we talk. This dream wire has got 10 centimeter hydrophilic tip. So why this is? So this is endoglide, basically M coat of thermo wire, which I had explained you. So this will have endoglide coating. So this is, and another important feature, because the nitinol has very poor radio opacity. So this tip will not be very clearly visible because thins out. The nitinol part thins out here, so will not be very clearly visible. So companies make it extra radio opaque by loading it with something. So two materials are commonly used. One is platinum and one is tungsten. So in this wire, like Dream wire and Jag wire, tungsten is used. So the tip will be very clearly visible under when you are using fluoroscopy. So you must have seen that shaft is not so well seen, but tip will be always very clearly seen in under fluoroscopy. So the tip is tungsten loaded, and in some of the other wires, it can be platinum loaded in this wire is. So there is, so in the Dream wire, what has happened that Jaguar tip, which was 5 centimeter, has been made 10 centimeter. So what is the purpose of this? The purpose of this is to negotiate the stricture with the alpha loop. So this is called alpha loop. The wire bends, but like the this ramp of the wire, this tends to open up the stricture and helps in negotiating. So this wire is especially like is designed in a manner, the tapering is such, taper, tapering is such that it forms alpha loop and negotiates the stricture. So that is how it helps. So again, dream wire is available in 260 and 450 centimeter. Again, standard shaft and strip shaft, and straight tip and angled. So uses I have explained you earlier. Then we have another wire which is called Hydra Jag. So in all previous wire, I had explained you that one end of the wire will be floppy, which is to be put inside the paste, in which goes inside the bile duct, and the other end remains in your hand. But this Hydra Jag wire is different because it has got both the ends which are floppy. Both the ends will be hydromer or aqua coat, like a thermo wire, and one side it will have 5 centimeter aqua coat, and the other side it will be 10 centimeter. So basically you can imagine ki one end is like jag wire and the other end is like dream wire. So they have combined the two into one, and then the name is goes like Hydra Jag wire. So if you want to negotiate the structure by forming alpha loop, you will put this side inside, and or otherwise you can with the 5 centimeter end one can put, or you can change in between by taking out the wire completely. Like if you are not able to negotiate with 5 centimeter tip, then with the floppy tip, then you can go for the dream tip, and one can go. So that is the advantage of Hydra Jag wire. So in the single wire, you have two types of floppy tips available, 5 centimeter and 10 centimeter. And 10 centimeter tip is exclusively designed for negotiation of a structure with alpha loop. Again, this is available in the same configuration, 260 and 450 centimeter, which I have told you, and straight tip and angle tip, which I have already explained you. So that is the Jaguar. So what happens that with repeated usage, normally all these accessories, all the guide wires, as per the company instructions, these are supposed to be disposable single-use guide wires. So, but for cost reason, most of the centers in India and most of the centers in Europe and some of the centers in Canada and US also, they tend to reuse it. So with reuse, the guide wire tends to get stuck in the working channel of the sphincterotome or the cannula which we use. So, and in the meantime, what happened that Olympus introduced a wire which had a stiffness of 035 in a diameter of 027. So obviously those thinner wire with 037, 0.035 wire in a diameter of 0.027 or 0.025. So that used to pass very smoothly, easily through that and without much of resistance. And so they made the wire which has all the configuration of jag wire. So 5 centimeter distal tip was aqua coat, and then rest of the shaft like that, but the diameter of 0.025, but that gave a stiffness of standard shaft 0.035 inch. And the tip was designed in like a dream wire manner. So, and the core was still again nitinol, and again the tip was tungsten coated, and strip marking was very similar to Jaguar. So, yellow black or yellow brown marking. So then came this is Jaguar Revolution. So this you can see what has happened. In Jaguar, you have like this. This is coat, which is nitinol, and this much thickness is coat, and this is core, which is nitinol, and this is the coat, which is polymer or the plastic. In Jaguar Revolution, what they have done, they have reduced the coat thickness, so without losing the electrical protection, so it will remain a protected wire, but give extra stiffness. So that is how the Jaguar Revolution has been made. Again, it is available in 0.025, because 35 it is not available because it is designed to give a stiffness of 35. So only 0.25 and 260 and 450 centimeter straight and angle tip. So that is Jaguar Revolution. And then we have Vigiglide, which is made by Olympus. So this is exclusively, this is unique type of wire. So again, it is like Jaguar, it gives thermotip, but the shaft is very, very unique. This has got a very special coating which no other wire has so far. This is fluorine coating. And that tip has another coating which is similar to thermo wire, but that is a proprietary item of Olympus and that is not disclosed. And they have done some loading at the tip. Again, this is not disclosed like in Boston Scientific. It is tungsten coating. So here it is. So radio opacity of the tip is very good. The fluorine coating gives help in exchange, and the tip is aquamer coated like thermo wire. So this is very hydrophilic tip. So this gives all the like Jaguar Revolution. This gives a stiffness of 0.035 wire in a diameter of 0.025 or 27 wire. And this is available in 270 and 450 centimeter. You should note that Boston wires are 260 and 450 centimeter, and this Olympus wire is 270 and 450 centimeter. And tip is again very similar. It is either a straight tip or angle tip. So if you see 270 centimeter and 450 centimeter, and the hydrophilic coating length is 70 millimeter, that is 7 centimeter. So in Jaguar, you had seen that the tip coating, hydromer coating was 5 centimeter. Here is 70 centimeter. So that is another difference one should remember. Vigiglide 2 is very similar, only the tip tapering correct. Vigiglide 2 is very similar to Vigiglide 1 we were talking. So it will have again 7 centimeter of additional 7 centimeter. We will be like thermo tip or aqua coat tip, and which will be atraumatic flexible uh, type of tip, and which has been redesigned to take a alpha loop, and the shaft will contains the fluorine coating as Vigiglide 1, and the torque control is better. So that was Vigiglide. So with the Vigiglide 2, the Vigiglide 1 stands discontinued. So this will remain. And the length of hydrophilic coating remains 70 millimeter, that is 7 centimeter. So this is how it goes. Like if you see the area, that terminal 50 centimeter, 50 millimeter, that is 5 centimeter, as in the Jaguar, there is no working at all, and this is like thermo. And then it is a different, slightly different color. Here it is very clearly green, but in practice it is not so clearly seen, but a different color. There you see that is 20 millimeter. And after that, the markings start, and ultimately it will have zigzag cross marking. So that can be seen very clearly in the magnification of scope. So then you have hydrophilic coating, and then you have a core. Core material is again is nitinol only. So that you can see. So that is Vigiglide 2. So then you have some of the very important wires available from the another competitor company, that is Wilson Cook. So torque wise, which I was talking about, this is how the torque wise uh, looks like in the Wilson Cook. So the guide wire will pass from here, and then you can slide this to lock the guide wire and rotate the guide. So again, Metro Direct wire is very similar to Jag wire. The 5 centimeter tip is hydrophilic. So this is a protected wire, so can be kept, and this is kink resistant wire. And this is tungsten loaded again tip, so that will be very clearly visible. And I told you that earlier all Wilson Cook wire, exchange wire, used to be available in 480 centimeter, and short wires 260 centimeter. So 260 centimeter is same as Boston Scientific, but 480 centimeter is you can compare it with the Boston Scientific, which is 450, but newer wires from uh, Wilson Cook are also 450 centimeter. So that is how these are very specialized wires. So 0.018, there are very few wires available. So this is very thin wire, and the tip is said to be malleable, shapeable, or groomable. So that can be groomed, meaning thereby, if it is a straight tip, you can make it angle tip with the help of your hand. And this can be used as exchange guide wire, but the other properties, good properties are not there. Like this is not a protected wire, so this cannot be used. So this very thin guide wire can be used where like the papilla very small, minor papilla, stenotic papilla, papillary stenosis we are using. So we are not able to go with a standard wire. Then we use this type of wire. Uh, this type of wire we can use. So those people who are trying to record, they can, we will load in YouTube channel Medicosmos. So they can have access after few days, maybe after a week or so. So this will be groomable tip. So this can be used as exchanger, but this is not a protected wire. So if we use for cannulation of CVD or PD, then we will have to obviously change the wire. So this is Pathfinder or sensor guide wire. And the other company, it is called Roadrunner in the Wilson Cook, and Pathfinder will be Boston Scientific. So the very comparable wires, though both are groomable and like that, but both are non-protected wires. So that should be done. This is another very specialized wire which came with very large fanfare. This is called Fusion Loop Tip Guide Wire. This is made by Wilson Cook, and again available as 260 centimeter, basically for short exchange purposes. Short exchange guide wire. So this basically alpha loop, which helps in negotiating difficult structure. So this came with built-in mini alpha loop. So this is this is magnified view. So this is not such a big alpha loop, but a small alpha loop. So that will becomes atraumatic and also helps in negotiating a structure. But it has not stand the test of time and the hype with which it came. And this is not sparingly used, occasionally used. This is a new guide wire from Wilson Cook. This is Acrobat 2. So this has got tapering tip. So this is controlled mm, uh, tapering, very controlled tapering. So that helps in making alpha loop. And then when we give torque, this is very accurately gets torqued. Otherwise, what used to happen when we used to give torque, then suddenly it used to jerk. So that is another one. And in Hydra Jaguar and Jaguar, you saw that there used to be tungsten loaded to improve the radio opacity. So this is platinum spring tip. So platinum spring coil is there at the tip. So that helps in radio opacity and also the negotiation. So this is a different type, but the shaft is again protected. So this is a protected wire. So this is protected wire. So that can be used for sphincterotomy. And shaft, they have done some modification. As modification, I told you that how modifications is done. Basically, it is the ratio of core and coat they change. So better possibility, meaning thereby that this will be semi-stiff wire. So again, this is the time Wilson Cook changed from their 480 centimeter prototype to 450 centimeters. So it is not this wire is available in 260 and 450 centimeter length. And the radio opaque tip here is 4 centimeters. So you have seen that in Boston wire, like Jaguar and Hydra Jaguar and Dream wire, it is 50 millimeter or 5 centimeter. And in Olympus, it is 7 centimeter. And here in Wilson Cook, it is 5.8 centimeter with a radio opaque portion being 4 centimeter. So that is a small proprietary changes they keep making. And again, it is available as straight tip and angle tip. So these are a small nitty gritty. So I will not go into that. There is another wire available, which is somehow has become popular in India. This is called Optimus wire from Tebung. So this is very similar to jaguar so has got a distal tip which is hydrophilic 55 uh, to 70 centimeter in different versions like straight it 55 angle 60, and again thin wire it is 75 and 70. So again different property modification which is as such doesn't make significant difference in during usage. So if you compare, so for exam purposes, the blanket statement that core of all the wires is nitinol. Because S glider is not into use, that is the only with the core stainless steel. So all other wires will have nitinol. So that solves your exam question that what is core made up of? So then it is nitinol. And what is sheath made up of? So uniformly you will say that it is made up of PTFE, that is a plastic polymer sheet, except for the Vigiglide, which contains fluorine coating. Okay, fluorine coating polyethylene. So polyethylene, there is polyethylene, and on the top of that, there is fluorine coating. Okay, so that is only in Vigiglide. So that solves the issue. And then the tip is again hydrophilic, hydrourethane, yeah, aqua coat, yeah, M coat, anything you can say in for exam purposes, all are same. This is all company variation which happened. Okay, so that is the thing available, and length I have shown you already that all
Recording in progress.
Wilson Cook wires used to be uh, in the range of 480 centimeter, and micro veggie 450 centimeter and 260 centimeter, and Wilson Cook also recently changed to 450 centimeter. So that is the thing. The next comes a sphincterotome. So a sphincterotome, when we talk of again like guide wire, we use certain terms which you need to uh, understand. So one is called pre-curved. So earlier what we used to have tip used to be straight. So now that has virtually gone out of production. It is available only on request. So all of them are virtually pre-curved. So all pre-curved sphincterotomes are basically pre-curved in a manner that they help in cannulation and cannulation into the bile duct. They are not especially designed to enter into the pancreatic duct. So one has to groom the tip to especially make it suitable for pancreatic cannulation. Then you have cutting wire. The wire which is used for cutting the, making a cut near the papilla, on the papilla. So that is called cutting wire. So this is of two types. One is monofilament wire, which will contain single metallic core, and braided wire, where there are multiple thin metal wires which are braided into one. So it is like the ladies or girls ponytail which they make. It is like that. So what happens that current flow is better with braided wire, but current flow is better, but the current density is not uniform. So if you see the cut made by the monofilament wire, it will be always a straight incised looking cut, whereas the braided wire will always have a serrated margin, and because of non-uniform current density on the braided wire. So technically, it is always, I feel that monofilament is better. And most of the current generation sphincterotomes will have monofilament. But braided wire was used because this used to be a stronger wire. And this was used to stand much force for the bending, because this cutting wire is also used for bending the sphincterotome, which we do during the procedure sometime for selective cannulation as also. And then double lumen and triple lumen. So double lumen sphincterotome will, what will happen, that one cutting wire will remain separate, and then you will have one more lumen. So one more lumen can be used either for guide wire or for injection, or using adapter. The same can be used for both the purposes. But in that situation, the contrast will coat the whole of the wire, and that makes the guide wire very sticky and very difficult to handle. So that is not very happy situation. So most of the double lumen sphincterotome have gone out of fashion now and not commonly used. And most commonly used sphincterotome, which I will show you just now, are triple lumen sphincterotome. So what are the three lumens? One is for the cutting wire, one is for the guide wire, and one is for the contrast injection. So these are the three lumens. So what happens, that contrast comes out at the tip and it doesn't get smeared uh, on the guide wire. Then we have the shaft diameter. Shaft diameter for most of the sphincterotome will be around 7 French, and that will taper variably to the tip. So a standard sphincterotome, it will taper to 4.9 French, and in some of the companies, it will taper down to 5.5 French. And taper and ultra taper sphincterotomes, it will taper down to 4.5 to 3.9 French. So we will see subsequently as we go along the time. And then there are cannulating sphincterotome. So cannulating sphincterotome are relatively softer compared to the traditional standard sphincterotome. So cannulating sphincterotome are designed to make the pancreatic and biliary cannulation. So they will bend easily and they will be negotiated. They will negotiate easily. So what you have here is ultratome. So you use two terms. You will see that some of the tomes get labeled as ultratome, and some of the tomes get named ultratome XL. In Boston Scientific, whenever you use the term XL, this is doesn't mean extra large. This means extra lumen. So ultratome will be a double lumen sphincterotome, whereas ultratome XL, when we talk of, this will be triple lumen sphincterotome. So that is the difference. So you should understand that XL is not extra large. This is extra lumen. So most of this is the wire which I was talking about. So this is called cutting wire. So cutting wire here, standard wire is 20 millimeter long, so 2 centimeter long. And but there is optionally it can be a wire any between 10 millimeter to 40 millimeter in different companies. Most of the time 20 and 30 like Ultratome, it is available. And this area of the sphincterotome, which is ahead of the cutting wire, that is called tip of the or the nose of the sphincterotome. So this nose can be short nose or long nose. 5 to 7 millimeter is called short nose. 10 millimeter plus will be called long nose sphincterotome. So which is better? So short nose give you better flexibility and maneuverability. That will be better with short nose. And long nose will be better stability. So it will go into the pancreatic duct or the bile duct, and it will give you absolutely a stable position. So even if you change your scope, push scope a little bit, the position of the wire will not change. So, so that is the crux of the issue. So remember that short nose, better maneuverability, better flexibility, and long nose, better stability. So that is how it works out. The Ultratome XL, I told you, this is triple lumen pre-curved, and pre-curved designed to be designed to enter into the bile duct. And so here you see you have the three lumens. So one is cutting wire lumen for the cutting wire, one you see the injection port, and one for the guide wire. But you note that the guide wire lumen here is not centric, not in the center. Okay, so guide wire will always come eccentrically from the tip. So there is going to be another version where it will be completely centric, because centric makes the cannulation of the bile duct or pancreatic duct easier. So here you see that cutting wire 20 millimeter and 30 millimeter, 2 and 3 centimeter length optional. And then you have a nose, which is short nose is 5 millimeter and long nose is 20 millimeter. So if you see different companies, so this length of the nose will vary. And I have already explained you the utility that short nose give you better maneuverability and long nose will give you better stability. Triple lumen will have lumen for the guide wire cutting wire and contrast injection all separate. And the cutting wire will be 20 or 30 millimeter. It can be monofilament or it can be braided. Most of the time it will be monofilament. So true tone. So what has changed from in true tone from ultratone? So true tone has become rotatable because previously I told you that ultratone and ultratone XL are pre-curved. This is also pre-curved, but there the tip diameter we could not change. Here the tip direction we can change. So it can be steered like this in this manner. It can be changed. So you can understand that if you are going into pancreatic duct and you want to go into bile duct, this can be helpful. But theoretically, but practically, what happens that this transition is not very smooth. So this doesn't get maneuvered to the extent which we always want. So that is control steerability that has come to limited degree. So that is good, but that can be improved further. So there is another thing in this guidewire that this is available. Like I told you that 7 French tapers to 5.5 French in case of ultratome XL. And this happens that in true tome, it tapers to three sizes. This is 4.9 French, 4.4 French, and 3.9. So you can have true tome 49, true tome 44, true tome 39. So when you are ordering. Second, what I had pointed at you in ultratome XL, it comes eccentrically. So that convection becomes difficult. So this comes centric, so cannulation becomes easier and smooth. And this tip has become got redesigned. So this is very, very smooth tip. So that this became more traumatic. And then the center injection lumen has become centered. So that is also injection is smoother. And then what has happened that when you bend, this is a sort of lock. So there is a handle brake. So because as I told you earlier, that this bending of the sphincterotome is with the help of the cutting wire. So as you tighten the cutting wire, it gets bent. But the difficulty is that sometimes if you do it too much, then this cutting wire tends to break. So there comes the significance of braided and monofilament wire. But this is sphincterotome has a different technology, which is called friction plate. So what will happen if you keep bend it and leave it as such? It will change shape a little bit, but will not completely return to normal position. So this is called handle break. So bending will remain till the time you completely undo it or you pull the sphincterotome completely into the channel when it will get straightened. So true tome is advanced version of ultratome XL, has steerability, has the handle brake and controlled steerability it has got. So that is the advantage. And again, I told you that most of the accessories are available in 200 centimeter length, cannula and sphincterotome. Tip length is 5 millimeter here, and the cutting wire 20 or 30 centimeter you can opt for. And 3 tip diameter 4.9 French, 3.9 French, and 4.4 French. So depending on your need, one can go for. So it initially as a beginner, you will tend to think that you will have the thinnest one so that it works in all sorts of papilla, but the thinner ones become very traumatic. So the idea is not to use the thinnest one. The good idea is to use the most blunt one. So 4.9 is the standard one which we tend to use, and we move to 44 and 39 only when for the specific need, because that is more traumatic tip. Then these clever cut sphincterotomes, these are very similar sphincterotomes which are available from Olympus. So this you can see by the color design also, because in the Boston Scientific, the central mark will always be brown or red. And here you see it is blue and green. And the second, if you see, the wire is changing in the different in proximal half and distal half. So what is happen that towards the scope side or the shaft side, the 50% wire is actually insulated. So although cutting wire, it is called cutting wire, but only half helps in cutting and rest half is not. Why they have done this? So even by mistake, you should know, if you activate the active your pedals of electrosurgical unit, so there is no accidental injury. And anyway, when you are doing a sphincterotomy, either biliary or pancreatic, you are supposed to put only 1/3 inside and 2/3 should remain outside. So this will commonly will get you will get a question like that in exam. Examiner will like to know that you are helping in assisting in ERCP or not. So they will ask you. So the rule of thumb is what? That you don't, there is no 2/3, 1/3 marking. So what is happened? There is one mark always in the center. So you keep that center mark always in place. So you are less than 50% inside. So then that is taken as that you are 30 to 40% inside, you one maybe. So that is how the sphincterotomy will be done. So again, here the friction plate handle, which I had explained you, that is available. And the tip is atraumatic. Again, you have working length here is 1700, so 170 centimeter. And the tip diameter, it will accept the guide wire 035 and 025 and 027. So that is convenient. The cutting wire available length, we have 20, 25 and 30 centimeter. So you saw that Boston Scientific, there is no option of 25, but here you have option for 25 centimeter. In the Boston Scientific, the tip, short nose, long nose, which we were talking about. So we had only two options of 5 and 20 centimeter. And I told you that for short nose, we 5 to 7 millimeter and long nose 10 to 20 millimeter. So here we have going up to 30 millimeter. So ultra long nose is also available, but otherwise 3, 7 and 15 millimeter. So 3 and 7 will be classified as uh, short nose, and the others will be long and ultra long nose sphincterotomes available. So this is very specialized type of cutting instrument available, which is called micro knife. This is triple luminous sphincterotome. Triple lumen device, one for contrast, one for guide wire, and then one for the cutting wire. Again, 0.35. So this is basically used for making freehand incision. Mostly for freehand incision, and guide wire is not for guiding the incision. This is post incision when we are trying to cannulate the CVD or pancreatic duct. So basically, this is used for pre-cut sphincterotomy, but this is also used to make puncture at different places. Like when previously cystogastromy, we used to use the micro knife to make puncture, advance the wire, and subsequently can dilate and place the stents. So this is micro knife. So micro knife, there are different from different companies, different configurations are available. Some of the knives are here. This is handle is typical prototype of Boston Scientific. So here it will be the needle type, and from Olympus it will be broad and flat. So it will be the plate type. So this is different type systems available from different. And then I told you this is cystotome. So what I used to be earlier used to in cystogastrostomy, we used to make a puncture, advance the wire, and then dilate, and then place stents. So what used to happen, if you have in cystotome, if you have clear fluid, then it is okay. But most of the time it is not the pseudocyst, but it is basically walled off necrosis, and the fluid is very turbid brown, and lots of fluid comes, then they obscures the vision. So the procedure used to become messy, and there are too many exchanges involved. So new device came up. So what it has a needle knife of thing, but it also has additional electrodes proximally. So as you advance and go into the cyst cavity, so you can use this to coagulate coagulate the wall of the pseudocyst. So this is called cystotome. So you one step you will do everything, and then you can just dilate or don't dilate, and then you go. ERCP cannulas are not in fashion now, because most of the cannulation work is done with the help of sphincterotome only. But you should know that occasionally for a specialized situation and for a difficult situation, we still resort to occasionally to the ERCP cannula. So ERCP are most cannulas are pre-curved cannula, and they taper to variable degree, and depending on the tapering, they are called standard cannula, taper cannula, ultra taper, and 543. So these are the different degrees of tapering. So most of the cannulas will have the shaft diameter of 5.5 French. In sphincterotome, if you remember, I told you the shaft diameter is something around 7 French, whereas in ERCP cannulas, it will be something around 5 to 5.5 French, and then it will taper to either 4.5 French standard cannula, and taper to 4 French, ultra taper to 3.5 French, and then there is a very specialized which is called 543. So 5 French will be shaft diameter, and the tip will be 3 French. But as I explained you with the sphincterotome, that the more tapering, the more traumatic. So we tend to use the most blunt tip. Then these are the pre-curved contour cannula that I explained you. This is available in 210 centimeter standard tip, taper tip, ultra tip, and 543 that I have explained you already. Then we have a specialized like ball tip and metal tip cannulas, which are for very specialized purposes. And then we have slightly specialized type of cannula. So this is tandem axle. So all these cannulas, previously described cannulas, are basically single lumen or double lumen. So one can put the guide wire and inject contrast, contaminating the guide wire. But in the tandem axle, the contrast injection is separate, which goes through two lumen. That's why it is called triple lumen. You will wonder that where is the triple lumen? So contrast goes through two lumen, and guide wire goes through one lumen. So that is how it becomes triple lumen, and it accepts. Unlike the standard cannula, which is 5 to 5.5 French diameter, this is 7 French is the shaft diameter, and it tapers, the tip becomes 5.5. So still it is larger than the standard tip. So that can be used, and but this is triple lumen. This will be triple lumen. So biggest advantage here is triple lumen. So I think we will stop today here only. We can take up some of the questions. We can take some of the questions here, and rest we will complete the other day. Okay. So.
Okay, sir. Sir, so tomorrow we'll be having class at 6 p.m., sir?
I think not tomorrow. We'll have on Sunday.
On Sunday. It's coming day after tomorrow.
So if somebody wants to ask question, I think in the chat box there are some questions. Let me see the chat box, and I will try to tackle answer some of that. So one thing is like guide wires hydrophobic or hydrophilic, when to use, sir. So hydrophilic is for negotiating the structure. So basically tip you want hydrophilic, and hydrophobic you don't want any time. So that is very clear cut, because that will create a difficult situation. So next you want pushability. So pushability is basically a smoothness and a stiffness. So smoothness of coat and stiffness of core. So the stiffer the wire will be, the more pushability will be there. So while describing the wire I gave you, but hydrophobicity you don't want. Okay, that doesn't help you anyway. So there is another question that so many sphincterotome, how do you choose? So little bit experience, there is no hard and fast rule. But rule of thumb, I told you that you will choose monofilament wire over braided wire mostly. You will 20 millimeter cutting wire over 30 millimeter wire mostly, unless a specific situation. You will use short nose routinely because short nose will give you better maneuverability. Long nose only for some reason, if you want a very stable position and you have lots of room inside the bile duct or pancreatic duct. Sometimes there is not so much of room. So long nose only occasionally we use for stability purposes. And then small advantages like clever cut is proximal wire is insulated. So what happens that if you have working very close to papilla, then what happens that part of the cutting wire comes inside the channel. So if you that is not insulated, that can result into short circuiting of current. Short circuiting of current will result into either damage to the cutting wire, damage to your scope, or damage to your patient because of short circuiting current. In that situation, obviously, the insulated cutting wire is helpful. So in that situation, we will use the clever cut. Then the thickest tip, possible tip. So mostly we will use 4/9 true tome or ultratome XL. But if the tip is very stenotic, narrow, in that situation, we will go for 4/4 or 3/9. So those are the general rule of thumb which I see. Different wire for pancreatic cannulation. No, pancreatic cannulation, the wire remains same, but most of the time we use hydrophilic wire. But as you see that most of the hybrid wire will have a hydrophilic tip, 5, 7, or 10 centimeter. So that is okay for pancreatic work. So you don't require very other specialized wire for that. Occasionally, for very stenotic situation, we will go for Pathfinder or Roadrunner, which is 0.018. So that answers most of the questions now.